Guys, welcome back to Medical Coding with Blue. All right, today's topic is all about a day in the life of a medical coder. I got a really good group of questions from a viewer, and the answers to these questions is going to basically fill in what a typical day is like for me in my facility, okay? Now, I will preface this and say that every facility is different, okay? Every medical coder is different. Not every medical coder is going to do all the things that I do, but this is a typical day for me. I am extremely engaging with my providers. I am engaging with other coders. I am never one to back down from a challenge of doing a harder clinic or working on problem issues, right? Whether it is trying to help a provider to understand the importance of clinical documentation improvement, or trying to get them to document everything that they're doing so that they can get full credit. Now, it all depends on how invested this coder is, any coder is, in their clinics. Some people have very easy clinics and they can, their job is sort of monotonous. It just depends on where you are, what clinic you're assigned to. I happen to have a lot of very difficult clinics. I code for orthopedics, podiatry, neurology, rheumatology, and pulmonology. I also help out with pain and physical medicine and physical therapy. So these are other things that I do talk about. I don't necessarily code the last three, but I still do help with and answer questions whenever those providers need help or assistance or whatever. So it all depends on where you are. Now, this may seem like a lot. Again, I'm going to preface this. It may seem like a lot, but this is what my days look like, okay? The first question was, what percentage of the day are you actually coding versus other activities? On a typical day for me, I would say it is a 70-30 split. 70% of the time I am working and coding and actually doing things. The other 30% of the time I am either working with a provider, answering questions from providers or other coders, or sending out a coding tip of the week, or working on continuing education through my work. We have to do continuing education for like HIPAA and making sure we do computer compliance and things like that. Those are the things that I'm talking about when I'm talking about continuing education. So these are things that we have to do in order to maintain our computer access. This is very important. So these are the things that I do. This is typically what goes on in my day. Today was a little bit more a 60-40 day because I did have to work intensively with one provider. I will be honest with you, I was not successful. I was not successful because she was not happy with me. And my whole thing is always trying to make sure that the providers are understanding what we need to see. What are we seeing on our side? If the documentation is not complete, or if the documentation is not as clear as it needs to be, this is when I sort of start to say, okay, we need to stop and we need to go and look at this stuff. And I call it putting out a fire, because when I have these issues that come up, and sometimes they will be brought to my attention through an audit, or when I'm running a report for like errors and things like that, and I can catch those errors quick and be able to put out a fire before it gets out of hand. So that's what I typically do, because I try to do a lot of things preventative. I don't want to have to be in a situation where I'm like scrambling and falling behind. I like to stay on top of things. Lately, I have been working a lot with other providers, and for this particular clinic, I had not had a lot of time. But this clinic is typically not an issue because everything is streamlined, everything stays the same. But suddenly, they change their documentation, and so when they change abruptly without notice to me, it is an issue because the way that I train them to make sure that they're getting credit for everything is that I explain to them, if you are taking extended time with a patient, you are allowed to get coding based on time, but the time statement has to be in there. You have to tell me what was going on, what caused this extended time, what coordination of care measures did you take, What did you talk about with the patient? What was the resolution of this whole thing? What are some of the other things? Did you talk about safety? Did you talk about the prognosis? What did you talk about? Again, what was the necessary need for this extended time? And again, the kinks had already been worked out of this whole system, and everything had been working fine. Anytime they had an issue with a patient that had to have extended time, this was in there. Everything was documented like it should be. And then I looked today and I was like, what happened? Why did you change? And so I went through the process of explaining why why it has to be documented in a particular way, and why you can't leave out these details. When you leave out these details, I can't give you credit based on time for no documentation being there. And what ends up happening is you end up getting less credit because, again, I have to go what is based on documentation. I am not in the room with you and the patient. So I don't know what happened. And so, again, she wasn't happy with me, but it's okay. We will get it worked out. I do have that hope and that we will work it out. But I did work with her a lot today, and it was very draining. It was a very draining thing because when you have a provider that is upset, and you're trying to explain to them the reason that you need to do things, sometimes they don't understand. And if they've had exposure to other coders who were maybe not as familiar with their specialty, and they didn't talk to them about these things, because sometimes, like, if you're not familiar, you're not going to talk about stuff that you don't know. And so I think that was the case with this provider. And so again, when me going into this clinic from last year and bringing it and turning it around and making sure that everything is good now, and then sort of the provider reverting back to old habits is very hard. It's something that there needs to be a little bit more communication. Unfortunately, I am in one side of the hospital and she's on the other. And so the onus is on me to be able to go to her and make sure that we have a one-on-one, so that she knows that I'm trying to be supportive of her. She knows that I'm trying to work with her on this mission of making sure that all this documentation is there and complete. So I have my work cut out for me. And again, I was working on that today. So I think today was more of a 60-40 day, where I'm 60% working on encounters and 40% of working with providers and doing those sorts of activities. And it's not always like that. Some days I get lucky and it'll be 80-20, 80% coding, 20% doing other things. Again, not everybody is the same. Not everybody's going to operate the same. But these are the things that I do because I am very detailed, and I like to make sure that providers are being as detailed with their documentation as well, because this benefits the patients too. When they leave and they have these complete medical records, and you know, I've heard it before where providers they say, oh yes, well, when my patient, you know, went to another facility and they had their records with them, the other provider was very happy because all of this documentation was there. So, and then I get thanked for making sure that I have to be this, you know, person that stays on them to make sure that this stuff is documented like it should be. So it helps all the way around. But you have to have somebody that is on it, you know, and that's me. So sometimes the percentage of coding time that I do have does go down a little bit, but because I have trained my other providers well, I'm able to get through other encounters fairly quickly. So I'm able to make up that time. But again, this is a lot of training, and this is a lot of time that went into this to make it this way. So that is the answer that I have on that one. The next question was about using the encoder. How is it different from using the manuals? Well, the encoder is a really great thing, but it's good and it's bad. Okay. I will say this. With the encoders always have to be updated, okay? And eventually I will, oh gosh. Sneeze. Oh, okay. Okay, with the encoders, they have to be updated. When the new codes come out at the beginning of the fiscal year, right, when the new codes update, the system has to be updated, and sometimes it's a little slow. So if there's a lag, you know, those things sort of affect using the encoder. And sometimes you have downtime from the encoder because there's system updates, or there was a computer problem or whatever. Of course, with manuals, this is never an issue. I mean, I think the worst that'll happen is you get a paper cut, which I've gotten quite a few. But the difference between the two is obviously the encoder is much faster because you're just going through the computer and the pathway and the code pops up. You do have to maintain your speed with the manuals, though, especially if you are planning to take an additional medical coding credential test. You can't use the encoder when you're taking a test. You have to use the manuals. So again, don't get rusty with using the manuals. And the thing about using the manuals is you can go through these books and you can see physically what's going on in the book. You can also look around the section that you're looking at to see if there's a better fit of a code. Because sometimes that'll happen. You know, you'll see something, you'll look it up, you think, hey, that's the code, and then you get to that section and you think, oh, that one's more specific. Let me use that one. But it's not in a way that you would have thought to look it up. So that is something to keep in mind. This is why, like I said, staying up with your speed using the books is very important. I will end up doing a demonstration video with using the encoder soon, okay? I haven't had a lot of time this week. Like I said, today was a 60-40 day. And I don't know how soon I'll be able to do it. But if I do have some time during lunch tomorrow, I will try to shoot a quick video while I'm at work during lunchtime. Okay, I want to make sure that's clear, okay? It will be during lunchtime, so that way you guys can see what it is like to use an encoder. And don't get overwhelmed with the encoder, okay? Everybody had to have time to learn to use the encoder as well. But the thing with the encoder is, if you are entering the information in wrong, and I will demonstrate that when I do the video, if you're entering the information in wrong, it is possible to go down the wrong path and get the wrong code, whether it is the diagnosis code or the procedure code. So again, it is all about understanding what you're reading and understanding the documentation and the doctor speak. You know, you got to be able to get all of those things and know the difference between the two. So this way you'll be able to go down the correct path. And like I said, I will demonstrate that tomorrow if I do the video tomorrow, because I always say something and then something happens. So I don't want to jinx myself. All right. So moving right along. What is my actual job title? They call us medical records technicians. That's what they call us, even though we're coders. But we fall under that class in my facility. So medical records technician is technically what my title is. But I work in the outpatient setting. So I work in the outpatient clinics. There are people who work on the inpatient side of the house, like they do the inpatient professional services, which is technically outpatient, but it's inpatient. So the patient is staying in the hospital, but then the doctor comes up and they do their rounds on the floor. That's inpatient professional services, because they still have to get paid for their cognitive work and the things that they do if they do any procedures while the patient is inpatient. So it gets a little weird to explain. So, but that's just one of those quirky things. Which brings me to the next question is, what are other job titles? When you are applying for a medical coding job out there, sometimes you will see level 1, level 2, level 3 coder, okay? And every facility is different when it comes to what a level 1, level 2, level 3 coder means, okay? Different facilities classify their coders level 1, level 2, level 3, depending on what their setting is. Some will say like a certain level is for same-day surgeries. Another one will say that another level is about emergency room coding. Another one is for inpatient coding. Another one is for outpatient coding. And then there's observation coding. So these are just different categories that these level 1, level 2, level 3 titles fall into. There are like risk adjusters. Somebody said risk adjuster, I think. But that's another, it's basically a coder that goes in, and I'm not really technically sure what they do, but it is a coding position. There's also positions with insurance companies. Sometimes insurance companies will be looking for actual medical coders who will look at claims that are coming in as far as auditing. So there's auditors, there's outpatient auditors, inpatient auditors, and they look at the documentation and the codes that were selected to make sure everything's okay. And that's just the insurance company's way of covering themselves. Which is smart, because sometimes, you know, people make mistakes, and if you catch it, you know, it's good, because then it's more efficient when it comes down to the money, or when it comes down to the statistics, because then we're making sure that everything is correct. And there's clinical documentation improvement specialist, which is another category. They have their own credential. The American Health Information Management Association offers a clinical documentation improvement specialist credential. If you're interested in that, be sure to visit ahima.org, ahima.org. And that way you can look into that credential. That is actually a very good credential to have. That is one of my goal credentials to get eventually. Like I said, there's a lot of stuff going on in the background that I'm not putting out on the channel yet. But currently I do have my Certified Coding Associate, my CCA, through the American Health Information Management Association. And that's all I'm going to say about that. But yeah, that's pretty much the answer to that one. But yes, you will see like a listing for like outpatient coder or inpatient coder. Sometimes you'll see remote coder. And those are the different categories of coders that are out there. It's always important when you are applying for jobs to put down any kind of background you have in medical, because at least this way they'll know that you have some sort of background. I didn't have any background at all in medical when I started. None. I was so far away from medical, it wasn't even funny. I mean, I had literally no experience, but I went through a temporary agency. So that was how I got my first job. And all the assignments that they sent me on was more filler for my resume. So that is something that you have to keep in mind, okay? But that's typically what happens in a day for me. I mean, not everybody talks to providers. There's some people that spend majority of their career never talking to a provider. If there's no communication with your provider, it's bad, because you don't know what they're missing and they don't know what you know, right? So it's important to always keep those communication lines open with doctors, okay, or providers, whether it's a PA or a nurse practitioner, or other providers, other categories of providers, whoever you're coding for. So be sure to, if you are a medical coder, or if you're going to be a future medical coder, be sure to say hi to your providers. Let them know. Let them see your face, because there are providers, even in my facility, that say that they couldn't pick their coder out of a lineup. And to me, that's pretty bad. You know, I make sure that I do some FaceTime every time I have a new provider, and I find out that I have a new provider. I make a beeline to their office and I stick my head in and say hello, because they need to be able to see me. They need to be able to know who I am, because if they have questions, I need them to know that that I am available. So today, while I was dealing with that proverbial fire, I did take a break from it, and I've been making it a point to visit providers that are in my area. My office is sort of centrally located, but it is within, hop, skip, and a jump of my other providers. So I'm able to sort of go from clinic to clinic, between two clinics, and where I'm at, and be able to just sort of stick my head in and say, hey. I did that today with one of my providers, and I said, I'm sorry, I know I haven't been around, but you seem okay with your documentation. Everything's good. You're doing really good code selection. You're documenting very well. I don't have any issues with you, but do you have any questions? And he's like, oh yes, while you're here. And I'm like, oh yay. And he's like, he goes, I do have a question. And he was asking me about tobacco cessation. And I was like, oh, okay. So, he had trouble locating the code. And so I helped him. And, we were able to get it sorted out for him. And he was able to say, oh, okay. So I explained to him the difference between the two, because there was two different codes he was looking at. And one code that he had selected was just a weird code that we don't use. And so I said, okay. So I showed him where the code was. And he's like, oh, well, this makes sense. So I did spend some time talking to him, and we talked about some other things as well. And, it's good to catch up. It's good to let him know that, you're there. And I told him too, if you ever need any questions or whatever, just, give me a holler or shoot me an email, and I'll be Janie on the spot. I'll run right over it and make sure everything's all right. But yeah, that is typically what goes on. Like I said, not everybody does this. So don't get overwhelmed thinking that this is what you have to do. No, this is just what a day looks like for me. And as you spend more time in this profession, things do get easier, and your confidence level goes up. And it does help when you are talking with providers, because as I've mentioned before, some providers can be very intimidating just naturally, their demeanor, and they don't mean anything by it. It's just how they are. And so it does take a little bit of like, hi, and it's just like, you try to have to sort of get yourself in check and be like, this person is a person just like me. And I have to remind myself like that sometimes, because it doesn't happen a lot, but it does happen sometimes. Like, I just get that energy of like, I feel intimidated. And then I just had to kind of like get myself in check. Like, I know what I'm doing, and I'm just here to talk to them and things like that. And I have to like be like, okay, so it does happen to me. So it's not all the time that I'm like that either. It's just sometimes it does happen. So like I said, it all depends on the person. But don't let somebody that gets upset with you, maybe a provider, don't let that deter you from trying again. Sometimes you just have to change your approach. And I think maybe because in going back to my provider that had the issue today, I think that I hadn't really talked to her in a while, because she had been okay. And that was my fault. I should have been more proactive. But like I said, I was concentrating on other providers that needed me at the time. So there's only so much you can do as only one person, right? So, but yeah, so I will go ahead and wrap up this video, but I think that's enough of me tonight. But if you have any other questions, let me know, and I will do another video. But I will be working on that Encoder video, because I have been asked about that before, so All right, so I will go ahead and close this out. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.